Hey everyone, thanks so much for joining Baltimore County Fire Department EMS Academy. For those who I haven't met, I'm Sean Barinholtz. I'm an anesthesia and ICU physician at Hopkins. I'm an active member of Pikesville Volunteer Fire Company in Baltimore County, and I have the honor of serving as one of the medical directors for Baltimore County Fire Department. On behalf of the medical director's office, Dr. Andy Pollack, I also know that Dr. Jeff Sagel's on the line with us tonight. On behalf of the EMS office, Captain Natz, the EMS Training Academy staff, and Captain Stewart, thanks so much for being here. Thanks for what you guys do every day, and thanks for your dedication to lifelong learning. Tonight, we're super excited to have with us Beth Fox. We had, not Beth, but me predominantly, had a miscommunication that resulted in some date confusion, and our original speakers weren't available. Beth was kind enough to step up immediately and say, yes, I'll do it. So Beth, thanks for being here. Beth joined the PET ER team in 2016 as the technician team manager for PET ER Columbia. She earned her vet tech specialist in emergency and critical care after joining the PET ER, working full-time and collecting case data to present in order to earn her qualification as a vet tech specialist. Vet tech specialist is the highest level education and certification available in the vet tech career path. As practice director, she now oversees the 24-hour operations of PET ER Towson. Beth has considerable vet experience, having worked in primary care, emergency and surgery referral practices, but found that emergency has always been her true passion. Patient care and comfort are very important to Beth, and she loves to learn and mentor other technicians. Beth, thank you for taking care of my own furry babies many times, and PET ER in Towson. Thanks for what you do, and thanks for being with us tonight.
Of course, thank you. What an introduction. So am I good to take it away?
You're up.
Okay. Please bear with me. Technology is not my strong suit, so I've met Ashley, and she's promised to help keep me on task. So what I'm going to do is go ahead and share my screen for you so we can get right into it. And so if you were here, and I'm going to go camera off just while I'm sharing, but if you have a question or anything, please put your hand up. I do have some help monitoring the chat, but I do like questions, and I like to engage over the topics. So feel free to shoot a question whenever. So if you were here last week, we'll have a little bit, or not last week, a few weeks ago, we'll have a little bit of a review. And the lovely ladies that did this presentation is Nikki DeJohnny and Steph Cole, and they really put everything together. So I'm going to try to do it justice. But right now we have a bit of a review from last class. So we talked a lot about behavior, especially what to look for when you're approaching an animal that might be at the scene of any type of incident, fire, accident, any type of traumatic event or just event. So you're really going to look at a couple of different things: ear position, eye position, sometimes mouth or whisker position if they have predominant whiskers, like particularly in a cat, tail position, and body position. So again, we're going to go through those kind of topics under each behavior type so that we can get a better idea of how to apply this when you're out in the field and meeting these animals. So first and foremost, we have relaxed behavior. These animals here speak for themselves. These are very relaxed creatures. Our cat friend even has its eyes closed. They're going to only close their eyes when they are comfortable. Most of the time, that's not going to be in a scenario where any of you or myself would be encountering them during a traumatic event. But it is good to know what baseline is. So if you're looking at your pets at home right now, hopefully they all look like this: very comfy, very happy, and relaxed. Next, we have alert behavior. So this is what you're going to really start to see when you have an animal that potentially was involved in a trauma and around a fire, or a potential for any of those things. So any kind of scuffle, anything like that, you're going to start seeing some alert behavior in these animals. They're probably going to notice things are off before we even do. When you're looking at ear positioning, things like that, you're going to be looking at pointing forward. They're looking to hear that sound. So you're going to start to see this little German Shepherd photo we have here. His little ears are probably on a little dial, just moving back and forth, picking up all the sounds. Big wide eyes, they're taking in everything around them. Most animals are fight or flight. So that means they are looking, they are flight animals in that flight or fight scenario. And so they are looking for their ways out. They are looking at, where can I hide? How can I run? Where are my people? All of those things. So they're going to be very, very alert of their surroundings, big eyes, wide open, taking everything in. They're probably going to have a very closed or tense mouth and kind of just general body position. Their tail's going to be out and ready to go. And that's just alert, that's balance, that's a lot of just that ready to move.
Hey, Beth.
Yeah.
So something happened when we converted over and it sounds a bit echoing.
Okay.
Can
Hold, please.
we just pause and
Yeah.
see if there could be some adjustments?
Of course. Let me see here.
Did you go to a speaker or a headset? Or?
Yes. Let me try that. Give me 1 second, everyone. Hold tight.
Because in the pre-conference, we sounded great.
Okay, how about now?
Say it again.
I said, how about now?
No,
Any
it's
different?
still echoing. Oh, some people are chiming in. Thanks for the group. No
Yep.
echo for me, Mark says.
No
So
echo?
Ashley and I definitely have a bit of an echo. What about others? Can you chime in on the chat, please?
And how about now? I'll talk a little bit too, just to make sure that it sounds a little better.
That sounds a little better. It sounds a little muted.
Okay.
Okay, others are chiming in saying, good for me, good for me. Okay,
Okay. Okay.
no echo here, no echo. Okay, good. Let's go.
Okay.
Thank
then
you, and
I
I'm so
will.
sorry.
No, that's okay. Then I'm gonna just keep going, and if there anything else, please stop me.
Yeah, perfect.
If anything else gets going,
Thanks.
I'll
Beth.
keep diving right back in. Here we are starting to see some friends that are exhibiting stressed behavior. And believe it or not, this little kitty friend, I think that's more of a playful cat. If anyone has cats or kittens at home, you've probably seen this face when they get all worked up and they're playing. But you can see those really dilated pupils. You're probably just not going to see this crouched position where they're playing. You're going to see a full flat pancake cat there. So again, you're looking at your ears, your eyes, the mouth position, the tail, and the body position. Cats, especially when they're taking in their surroundings, they might hang their mouth open like that it's called a flamen response. And they are essentially just taking everything in. And when they get weird smells, they absorb it all that way. With our little canine friend here, again, with these small breed dogs, I'm going to tell you right now, just to be careful with every small breed dog, they tend to be the ones that will have more of an exaggerated reaction, especially when they are in this stressed type of environment. So this little guy here, he's definitely got some big bright eyes. He's looking right at us, very alert, and his ears are starting to pin back. He's not really worried about flight anymore. Now he's contemplating that he's going to probably have to fight. So this is just a next additional step in a behavior. You may see more stress-like behavior after an event, a fire, a sick owner of a pet, anything like that that could cause stress to you or I will be very much a potential stressor for these animals. And now we have tense behavior, anxious behavior. This could very much be the case after a car accident, a hit by car, any type of fireworks, firearm discharge, anything like that. You could really see tense and anxious patients. Again, we have our kitty friend here who's taken in everything and its surroundings. You're going to see those pupils really dilate. And you have your haunched position of your canine friend. This dog is contemplating what he needs to do. Is he gonna run away, or is he going to try to bite you? And so again, you're going to see a lot of these signs in their body position, in their ears. He's kind of flat pressing his ears down. This dog probably can pull his ears up to be quite face forward, and he's really pinning everything down. He's making himself as small as possible. You'll start to see a lot of these behaviors present. And then we have aggression. We have a very dominant, aggressive dog on one side and a fearful, aggressive dog on the other. I think that a lot of our cases that we are going to see are fearful creatures. They are in unknown scenarios. They don't know the sounds. They don't know the smells. A lot of times they don't know the people, and they may not know you as first responders getting to the scene. So that's really the fear that you are going to see, and the aggression that you are going to see. You're going to see those ears pinned back, dilated pupils. The nose may be wrinkled. You're going to see some teeth, perhaps. They might curl their lip up. They're going to give you a bit of a warning. And then our dominant aggressive friends, this is really when you're looking at a service animal, a working dog. Those are the ones that are going to show that actual dominant behavior. And that is a beneficial when they are working in protection or working in any kind of police unit like that. So just knowing your audience, essentially, quote unquote, is best going in. And to our feline friends, you know, cats don't read the book. They don't know how to act like normal cats. So any cat can do anything at any time. That's just a good rule of thumb to keep in mind. Those of you that have cats would probably agree. They do what they want when they want. So you can go from squishing themselves way, way down to a pancake to they can stand up and they will come at you on two hind legs. It doesn't happen often, but we've seen some pretty wild things happen with aggressive cats. And the fearful aggressive, they're going to run. They're going to get as close to the ground as possible, and they're going to try to get away from you. Anecdotally, I actually lost a cat in the ceiling of the hospital that I worked at because it was a fearful aggressive cat. So things can happen. And note to self, if that ever happens to you, hopefully it doesn't, but just go get some KFC and put it in the ceiling and the cat will come down. So we've got a very quick review here on behavior. And again, we have a lot to cover, so I really wanted to kind of get through some of these nuts and bolts. We have a lot of videos as well. We're getting ready to go into the video slides, and we're going to have to juggle a little bit with our with the sharing because the video sound was not great. So we'll fly through those, and then I would like to take a pause after each set so that we can have any questions if there's anything that you want to discuss before we keep moving. Oh, we have a couple more, so excuse me, I was a little bit premature there. So we have some restraint items that we're going to go through, and these are the items that are in the video. And these are minimal, what I think would be very, very beneficial to have in a police car, on a fire truck, anything. If you're going to be encountering or potentially treating these patients, and these are very, very easily accessible. And I can certainly get with Dr. Barinholtz and figure all of that out if that's necessary. But muzzles, e-collars or Elizabethan collars, cone collars, more commonly known as cat gloves, towels, and comforters. Those are our big tools that we use. So you'll see a lot of these in the videos. All right, so we have cat restraint. Our next slide is the video start. So I'm going to go ahead and stop sharing so that we can get those videos going. Dr. Barinholtz?
Yep, working on it.
Yeah, okay.
Beth, can you see it?
Yep.
Okay, so generally less is more with cats. You want to make sure that you introduce yourself, and normally they like to sniff your finger or something. But if a cat is being nice, you don't need to scruff it. You don't need to do anything. Most of the time they'll just let you pick them up and they'll flop, and you got a cat.
So that was our first video, fairly self-explanatory. Nikki just approaches this cat, and that happens to be Sparrow, her cat. She approaches it and it just utilizes less is more. You can go ahead to the next video.
So if you do need to restrain a cat, you can try to scruff them. Sometimes it makes it worse. Sometimes it makes it better. And in the back of their neck, you're going to firmly grab this, and they sort of become paralyzed sometimes. So then you can manipulate them how you want. So you sort of have control over him right now. So if you want him sideways, I pick him up, lay him down, and I brace his back against my arm to keep him still. And then you sort of have control over him, and you can stretch him out. If he's nice, you can let go of his scruff, and you can hold him sort of like a dog and stretch him however you need to.
All right, we can go right to our next one.
Put an e-collar on your cat. Again, it creates a barrier between you and the animal, or so they can't pull their IV site out or whatever. If it's pre-built and they let you slide it on, you're just going to slide it on over their head and make sure you tie it nice and tight. Not too tight. You want to get 2 fingers under it. Tie it nice in a bow, and then he can't get to you.
So that's our e-collar, the Elizabethan collar or the cone collar. And we'll talk about that a little bit more later in the presentation, but this is a great tool, especially if you're transporting any creatures that have had wounds or any kind of trauma.
Next video.
Yes, please.
If the cat won't let you slide it over their head and you want to sort of come from behind so they don't notice, you can go under their head, slip it on, and then you're going to build it around them.
Next video.
Okay, you can also burrito your cat. So you're gonna lay them on a towel and sort of wrap them up nice and tight. And then you can bring out whatever limb that you need, and then the rest can't get to you.
Okay, next video.
Okay, say your cat is in a cage and very aggressive. He's trying to lunge at you, scratch at you, bite at you. Obviously, you're gonna want your tack gloves on, but I always suggest with a cat, throw a towel over them, then you can grab them however you need to.
Okay, next video.
Okay, if your cat is really aggressive, cat gloves are your best friend. So this way you can still feel a bite, but it's not gonna do anything. And if they start coming at you, they can bite this, but you can just sort of handle them however you need to until you get them sedated. I also use cat gloves all the time for your tiny little land sharks like your chihuahuas.
What does she call them? Land sharks?
Land sharks. Yes, that's what we. That's some industry knowledge for you there. Owners don't love that, but yes, we call them land sharks. You can go ahead to the next video.
Okay, if you have an aggressive cat that lets you put a muzzle on them, for a cat muzzle, this part's gonna go on top, and you're gonna sort of go into that, put their face in it. Their ears are gonna be on either side of this, and you're gonna pull down and tie it in a nice bow. And you're gonna restrain the same, they just can't bite you now.
Okay, you can go to the next video. Okay, so I'll pause here just because we kind of watched those videos in quick succession. So any questions on cat restraint, anything like that? We'll go through the dog restraint fairly quickly, and then we'll get into some of the other meatier stuff. Oh, I guess I should look at the chat. Okay, we can keep going. We can share the next set of videos if possible.
Okay, so first thing is a slip lead is your best friend, and the way you turn it into a slip lead is you put the leash through its own little tag, and then you can pull it like this. So when getting an animal, if you don't know if they're nice or not, you're gonna walk up to them nicely at the side or call them, "Come here, Sarge. Sarge, come here."
Okay. Go to the next video.
So you don't want to make sure to pull this ever too tight because you see how Sarge is coughing. So if you get a dog out of a fire or whatever, and you might not want to put pressure on their neck, you can put one leg through the leash, and then it's not anchored so tight on their neck.
Go ahead. Yeah, just as a quick side note, Nikki mentioned it straight away. So this would be a great technique to use if you notice any dyspnea or any type of difficulty post smoke or fire exposure, post drowning. They probably won't need a leash, but if there is any water that they're coughing or anything like that, this is a great technique for that. So you can go to the next video.
So if you need to restrain a dog just sort of standing up like this, if they're friendly and you can go under their arm, like under their neck like this, under their belly like this, and hold them close to you, and then you can manipulate them any way that you need to.
All right.
So if you want to restrain a dog laterally or on their side, you're going to have them next to you like this. Then you're going to grab their legs that are towards your body and sort of lift up gently and slide them down your body. And then you're going to hold their limbs that are down and put your arm over their neck, and this will hold them down.
Okay, you can go on to the next video.
Okay, so if you want to place a muzzle on the dog, you notice that the smaller part here goes on top. And if your dog's friendly, you can come at them from the front, but if they're a little bit timid or sketchy, you don't know, you want to sort of have them in between your legs and then flip this around over their muzzle so that they don't really see it's coming. And you clip it in the back. It's okay. And then you pull it nice and tight so they can't get it off.
Very good. Next video.
So if you need to place an e-collar, depends if it's already pre-made or if you have to make it around the dog. So if you can pre-make it and slide it on because they'll let you, you'll sort of come from behind, slide it over their face. It's okay. Like this. And you're going to have a tie on it, and you just want to tie that securely so that it stays on them. And this will just create a barrier between you and the animal.
All right, you can go to the next video.
And if the animal won't let you slide it on, you can sort of come from behind, slip this under, and then you're just going to build the e-collar around them. It's a little less scary to have an object coming at your face.
Okay, you can go to the next video.
Okay, so say Sarge is extremely aggressive. He wants to eat me, and you might need a buddy for this. But someone's going to be holding him with a leash, and you're going to take a comforter, and you're going to sort of go around them and behind, and this is going to create a barrier. So you're going to put a blanket over them, and then you sort of have a barrier so you can hold them, get to their head and stuff like that. That way you stay safe, and the dog is a little more calm. Okay. Okay, so this is if you have a highly aggressive dog. This is our rabies pull. If they're lunging at you and they have no other way to get to them, you can actually be safe with this. Slip this over their head. Sorry, Sarge. And then you pull it, and they're nice and tight, and you have hold of them.
All right, perfect. I'm gonna switch my screen back really quick. I saw at least one question come through. What is a safe way to handle a cat in a house fire rescue? That's a really great question. The safest way to handle a cat in a fire is to grab them with a towel, a damp towel if need be, or to get them in something and get them safely out. That could be a pillowcase, that could be a cat carrier, that could be a printer box. It could be anything that will get them out of that smoke the fastest. But my suggestion would be to keep towels or pillowcases, which it seems silly, but a cat can fit very well in a pillowcase. All right, so we are going to keep going with some zoonotic diseases. So zoonotic diseases are anything that is transmittable between species, mainly for the purposes of this lecture, between animals and humans. This is very important to just have a very general basis, general foundation of this knowledge when you are interacting with any animals this is even just a great refresher if you are having animals at home that you love and care about and are part of your family. We really don't talk about this a lot. So I am going to go fairly quickly through this part. There's a lot of information on the slides. I'll touch on the main points, and then we'll make sure that you get all the content of these slides. So what is the risk of transmission when we're talking about these zoonotic diseases? It really depends on the disease, you know, and that we have some that are a lot worse to public health, i.e. rabies, which is why we have so many rules around rabies vaccinations for animals and post-exposure vaccinations for humans. And really your health, so the health of the human that is exposed. Anytime you have any immune compromise, we do have a higher suspicion that or concern that you're going to have possibility of zoonotic transmission. So common zoonotic diseases in canines in particular, there's a nice long list here of fairly yucky things. Ringworm, salmonella, lepto is a big one that's huge with hunting, farming, just dogs that go to the park off leash. Lyme disease. Lyme disease is quite big in our area. We also see, which I don't see on this list, but which is not zoonotic, but we see a lot of heartworm disease as well. So all of these things that you're seeing here are zoonotic diseases, and somewhere in that life cycle, like in Lyme disease, you have that tick that is part of that life cycle on that either attaches to that creature and then to you or vice versa. So common ones in cats, again, this is a little bit of a shorter list, but lots of skin stuff here. Toxoplasmosis, that's even if you're pregnant, that is a huge thing to be concerned of. So actually talk to your doctor about that if you have a cat in your house and you don't know if they have toxo. So which ones are we most concerned with when we are day to day, and which ones would most likely be something that you all could encounter? We're talking about ringworm, leptospirosis, toxoplasmosis, giardia, cat scratch fever, scabies, and rabies. And the reason that we put all of these on here is that they are either close contact, i.e. saliva, blood, fecal transfer, or just close skin to skin contact that you could get over prolonged exposure times like ringworm. Unfortunately, it can happen. If you're holding a little kitten for a long time and it has ringworm, you're probably going to get it too. So ringworm, this is a general overview, but it is caused by a fungus. It's called ringworm because it can cause circular lesions, contact with objects or surfaces. A lot of times in hospitals, this is why we isolate these creatures and we use really strict cleaning protocols. If we even think there's a possibility that they might have a lesion that sort of looks like a ringworm, we're going to put it in isolation and really clean after that patient is done. We usually just restrict to wearing gloves and really good hand hygiene. For all of these, that's the number one thing I can say, gloves and hand hygiene. So again, we have some little circular lesions here that would be very common and characteristic for ringworm. Again, if you have time to look at your patient's skin or the pet's skin when you get to that emergency, great, that's wonderful. If not, cool, we'll look at it a few days after we've admitted it. Lepto. This is a bacterial disease spread through the urine of infected animals. It can be urine that collects in freestanding water. It can be all kinds of, it could be urine that is just on a blade of grass that your dog sniffs and licks. And then that's how it is transferred through direct contact with urine to mucous membrane, which sounds pretty gross, but it can happen. When we least expect it. So again, this is one of the ones where if you or any member of your family or a potential person that you are responding to, any kind of call has immune compromise, this is something that I would be concerned about. You're going to see this very traditional icteric presentation. Again, if you are intercepting an animal at the site of a fire or anything like that that looks like this, we are on borrowed time. And so it's time to get that animal into the emergency room. So toxo, this is a disease that results from an infection with the toxoplasma parasite. It is a very, very common parasite. Contract usually comes from eating undercooked contaminated meat or exposure from infected cat feces. So if you're cleaning out a litter box, that's where we see a lot of the problems. So how can we identify this? Clinical signs are going to present with just general not doing well, fever, and some neurologic to progress to some neurologic signs. So again, if you are suspicious, just have your creature evaluated. Giardia is another very common intestinal parasite. Anyone's even brought home a puppy, you are probably brought Giardia home with them. That's why we deworm them so much when they're little. Again, if you have any type of situation where there is maybe unsavory conditions that the animals have been kept in, or you are responding to a home that, you know, maybe just is run down, or there's some hoarding situations, you can see a lot of Giardia with breeding, hoarding situations. And it's very treatable. It can just be messy in the process. So how to identify this? Again, you're going to have to look at poop. And this is very much just for foundational information for you to understand what is out there. I would highly doubt that in the event of an emergency, any of you would have time to discuss whether or not these creatures had Giardia. But again, that's where just wear gloves and simple effective hand hygiene is really, really good here. So you can have diarrhea with Giardia. You're going to see some color change. We note green or yellow color. And sometimes there is blood present as well. Sometimes all we see is blood. So again, not everybody reads the book. And those lovely girls put in a picture of poop for you so that you have a point of reference. Cat scratch fever, we'll move on to that, is something that we do see, a secondary bacterial skin infection after a scratch. Sometimes it can even come from just one little puncture of a cat tooth. Cats are gross and they use litter boxes, so there's poop pretty much everywhere. And so anytime you have any kind of cat scratch or a bite, or even just like a hook with one of their claws, I've seen some really nasty wounds on people just from that. So that's something I would very much keep at the top and forefront of your mind, especially as we've already had a question about removing a cat safely from a house fire. This is something that could secondarily come along with that, even just transport and removal of that animal to a safer environment. This is something that could be secondary to that. So very much just keep everything nice and clean, wear gloves when you can. And if there is an event where there's a bite or a scratch or a wound of any kind, just make sure you clean it really well. Soap and water is fine. You do not have to bleach it. That was a rumor for a while. How to determine if the cat is infected. Again, I'm not quite sure you're going to have time in the field to really ask a lot of these questions, but it is good if you are starting to develop signs. You know, you can know, is there a history of flea or tick infestation in the animal? Do they have a history of a fever? Have they been showing any other signs or symptoms prior to the scratch or bite or whatever have you? Onto some more skin. We have scabies, which is gross, and we have brought it home sometimes. It is a skin condition caused by mites, and there's a couple types of mange that we deal with in veterinary medicine: Demodex and sarcoptic mange. So we just itchy creatures. And again, it's that contact time. It's really going to be, are you in there? Are you spending a lot of time in there? So I would say this is probably not something that you're going to encounter or have to worry too much about. However, if you are getting calls or there is any type of rescue or anything involved, this could be very much a part of that. We see that a lot with rescue animals or animals that need to be rehomed. that are not in great condition. You have some very textbook examples here. So again, if you're pulling up to any kind of event, fire, anything like that, and you see one of these creatures walking around, just throw some gloves on or pick it up with a towel. That works too. That's my favorite method. And then we have rabies, which, you know, is considered very much a public health threat. That's why we have such considerable rules that we have to follow from veterinary medicine and from a reporting standpoint and vaccination standpoint. We have a lot of structure around this disease in particular. It is deadly. It can be deadly, I should say, and it is spread from via saliva. It is usually spread through an animal bite, I believe, and don't quote me on this, I believe that the most common animal that it is a bat. But it is likely to can spread to dogs, cats, coyotes, fox, skunk, and raccoon. So again, a lot of wildlife there. And especially when you have indoor-outdoor creatures, they have an opportunity to really get exposure to that. Not terribly common in this area, but I would say in the course of my career here in Maryland, I've seen a handful of rabies cases, confirmed rabies cases. So it is out there. But you will see a lot of neurologic signs and symptoms. And again, it's not going to be probably even an animal that you would be able to get your hands on in the event of any kind of emergency. It can take 2 to 4 weeks of incubation before they develop any symptoms. That can make things more difficult, especially if we're treating on an emergent basis. But there's a lot of factors that it will be based on, and severity of symptoms can just range from all or nothing. So we have some ways and tips to identify. We break down some clinical signs here. They can really become agitated, or they can flip the other way and very active, and social pets can become much more nervous and shy. The most of the time you're going to see these neurologic symptoms, anger, aggression. I guess anger is not really the right term, but aggressive behavior, neurologic behavior. A lot of it, these creatures just don't look right. Cats and dogs, again, we have some information here, and there's a lot of information on these slides, but in the interest of our time, we're going to keep moving, but we'll make sure that you get all of this content. So we have some additional clinical signs here and specific to cats. So we're going to move now into burns. Any questions or anything on zoonotic disease? Not always the most fun concept to review, but it is a good thing to keep in mind when you're out in the field. So we will keep going through to burns. Again, remember, if you want to ask a question or want to type a question, please don't hesitate to, but please do put your little hand up. I'm not keeping close eye over there. So we're going to move into burns. All right. So what we see most in the ER is going to be secondary burns from some type of exposure to an item most of the time. That is electric heating pads. Owners have them, they turn them on, even though electric blankets, you have it, it's not really regulated. You turn it on, your creature lays on it, and then they can stay on there. It feels delightful for them. They don't get up. You have a burn there. Direct fire or smoke exposure, scalding water, stove tops, contact with radiators, heat lamps, car mufflers, car engines, improperly grounded electrocautery units, and improperly grounded outlet, radiation. We see a lot. What you are most likely to encounter is fire exposure. Scalding water, honestly, I have not seen that in my career, but I would say you're looking at fire and smoke exposure for sure, and potential if there's any type of conflict or firearm discharge. I have seen secondary animal injuries. I've seen stab wounds and gunshot wounds. So all of those are possible. We did discuss wounds in greater detail at the last lecture, so I'm sure that that's floating around somewhere, and we'll go over a tiny bit here. So for prognosis for burns, if 20% or more of the body is involved, then you're looking at some pretty significant side effects: cardiovascular shock, hypovolemic shock, to sepsis and death. If more than 50% of the body is involved, then you have a significantly poor prognosis. It is difficult in animals to assess the true nature of the damage, and it can take up to 3 days to declare itself while we're trying to start treating. So what we're going to do is break down our process of burn management. So we have kind of a little flow chart here for you to see and reference. And it's pretty straightforward. Is your patient responsive? First and foremost, I do not care about that burn if the patient is not responsive. We're gonna go in order of importance. So if it's not responsive, we start CPR. If it can be safely handled and we don't think we're likely to push it over, we're going to start treating that, assessing the wound, probably getting the catheter placed. You're going to do a full physical exam, nose to tail. You're going to also take a really good look at those paw pads, especially with any kind of radiator contact or oven contact, stove contact, where you get cats that will just paw pad across those hot things and not know until it's too late. Within 2 hours of presentation, we're going to get cool water going on that patient. They recommend a cool water lavage for about 30 minutes. Most of our sinks are just the spray nozzle. We just throw them right up on the sink and just hose them down. Large areas can be submerged. I prefer the gentle lavage and gentle pressure of just a really light and fine mist of the water. Cool towel to compress, or a gentle hose for the limbs. Again, I prefer doing that lavage with the nozzle. And transfer to an ER hospital. Most burns require immediate attention. Again, our patients decompensate fairly quickly, as I'm sure all burn patients do, but it's especially difficult when they can't talk. So for what we're going to move on to traumatic injuries. Any questions on any of that thus far? Because we'll keep flying. Okay, traumatic injuries. So what we see most often is hit by cars, car accidents. An owner themselves is just driving their vehicle and they are in an accident. We see a lot of secondary animal injuries because animals are passengers. Fights, big dog versus a little dog. Falls from heights, we call those high-rise animals. Blunt trauma, gunshot wounds. What you will most likely encounter, what I would expect is those car accidents, fall from heights, so high-rise creatures, or a cat that is in a tree that falls, that's less likely than a high-rise, and gunshot wounds. So when we are talking, in particular here, they're referencing traumatic brain injury. So when we are talking about traumatic brain injury, we again have that same flow chart that we're referencing. So again, if your patient is not responsive, please start CPR. We reviewed that last time, and I think we can send some of that information again after this presentation. But if no response, start CPR. Get that full physical exam going. Look for your wounds. Look for hemorrhage, and minimize your patient movement. You really want, as we're assessing, we need to keep that animal as still as possible. If you notice or assess a hemorrhagic wound or a wound that is actively bleeding, apply lubrication to the wound to keep that tissue nice and moist as you're getting en route to the hospital. Apply a bandage or tourniquet, whatever is applicable. Same rules apply from animals across animals to humans, so you can't really do it wrong, especially in the short term. So even if you just get it to us, that's a-okay. And then transfer to us. And again, we did cover this in the last discussion, but as much notice as possible is best, and as much information as you can obtain as safely as possible is best.
Hey, Beth,
So when we're,
go back a slide.
yeah, of course.
So first of all, I don't know, everyone's quiet, but this content is great.
Well, thank you. That's okay.
Yeah,
It's
you're doing great.
7:47 on a Thursday night.
I don't
You
think
don't
that-
have to get charged up about traumatic brain injury.
I think the vast majority of us have never seen this type of content.
Well, thank you.
So quick question. So what kind of lube like that we would have? I mean, what do we
Do you,
have?
well, I guess the question is, do you carry sterile lube?
No, definitely not.
Okay, because
So none of
I
that. And
yeah,
then what about avoid material with clotting activators? You know, we have all these trauma dressings nowadays that have clotting activators.
you absolutely can use those.
Okay.
We don't use them a lot. The most we would use is intra-op, like in the OR. We have, and I can't think of the names of the things that we're using right now, but as far as first response to wounds, we haven't really picked up on using that, but if you've got it, throw it on there. Can't hurt.
I agree. Somebody else, who transport animals from fires or crashes? Who transport?
I don't know the answer to that. That's a great question. In the best case scenario is if the owner can. The best case scenario is if the owner or some other representative of the owner is able to transport the animal. I don't want to answer and say if I think.
Yeah. No,
Yeah,
no. Yeah, I get it.
I could step in it real quick here,
I'm
but
staying quiet too. A little bit. You know, I mean, my sense is, you know, when the state EMS director sends out a memorandum, right, to all EMS providers that really, you know, encourage us to provide support for small animals in the field. I mean, that's what led to this training, right, and the partnership that we've created. So I think, yeah, I think we're talking about maybe even using I'd consider if I was out there using the medic.
yeah, I will tell you.
That, but I'd
Yeah.
think about that.
I
Certainly
have
talk
had,
to the supervisor.
yeah, I have I'll just tell one story. I have had a patient be brought in by, I want to say it was an ambulance that had responded to something, and they brought in this pet with the best abdominal bandage I've ever seen in my entire life. Yeah, it was really great. I think we might have even taken a picture of it. So it has happened, and those young men actually had an opportunity to bring the animal directly to us, and so they snatched it. I think they asked for forgiveness later.
Right.
Yeah, so
How could you go wrong helping a small animal? Come on.
I mean, that's what I think. So you're never going to get, I'm not going to be ever upset. Okay, so I'll keep it going. And we'll go into a little bit of the thoracic and abdominal trauma. So with hit by cars or those stab wounds, and I hate to be so dramatic and to constantly bring up stab wounds, but I've seen a few in ER over my years. So a lot of times they happen on accident because our dogs are protecting us. I've seen a lot of gunshots and a lot of stab wounds that happen secondary to conflicts with owners. So we are harping on that for a reason. But when we are talking about thoracic and abdominal trauma in the ER, what we're thinking about is perforating trauma versus blunt trauma. So you've got your bite wounds, your stabbings, gunshot wounds, or impalements from objects. I've taken a lot of sticks out of chests, and the dogs run, and they have this very nice thoracic inlet that points in a little bit of a different angle than ours, and so they're running through the woods and they just impale themselves on sticks. So I've seen a lot of that. And then you have blunt trauma, hit by car, high rise, falls, like we were talking about, pulmonary contusion secondary to that, or trauma. Pneumothorax, hemothorax, rib fractures, flail chest, abdominal hernias, urinary tract ruptures, and bladder ruptures. We see a bunch. What you are most likely going to encounter, hopefully, you don't see all that other stuff, car accidents, gunshot wounds, stabbings, and impaling from objects. I would even chance a guess to say that impaling from objects, those owners are probably okay and hopefully have not been in a traumatic event themselves, so they can then transport their pets to the ER. So lots of goodies there. So when we're talking about breaking down the process of thoracic and abdominal trauma response, again, I'll say it, this is till I'm blue in the face. If it's not responsive, start CPR, which I'm sure I'm preaching to the choir on this one. Full body physical exam, we're looking for any open wounds, active bleeding, a blocked airway, probably gonna look for that first. Don't remove any penetrating objects. Again, same rules apply. If it looks like it's gonna bleed, if you take the object out, leave the object in. Wrap around it, bring it to us. Minimize patient repositioning. That's going to be almost impossible, especially if they are having anxiety. So what I would say there is that's when towels, t-shirts, things like that are going to be your best friend, so that you can create kind of like that burrito scenario, especially for the smaller animals. Again, bandage and tourniquet, you're not going to do it wrong. So the max that bandage is going to be on is an hour, and we're going to take it right off when it comes in. So again, you're not going to do it wrong. I'd rather have a poorly placed bandage on, although what I have seen historically when I've worked with any type of EMS is that they bring the most beautiful bandages and transfer to us. And again, please call when you're on your way. It's the best option we have. So when we're talking about wounds, we are going to go into next wound classification. Closest hospital for pet trauma. Baltimore County would be us in Towson, or there is an emergency clinic in Bel Air, Animal Emergency Hospital, AEH in Bel Air, and there is an urgent vet care in Cockeysville. More will probably come to me, but those are coming to my brain right now. When we talk about wound classification, we are going to start with 4 classifications here. We have clean, your surgical wound that we created. We have clean contaminated. We have a minor break in aseptic surgical technique. Contaminated, where you have a wound related trauma with bacterial contamination, or a dirty or infected wound, a wound with obvious infection. Most of the time you're going to encounter clean, fresh wounds, I hope. So in that case, again, just bandage them up, and the best description that you can give us, but we're going to bust out that bandage as soon as we get it and take a look ourselves. So the most information you can get about the nature of the wound, when it happened, how it happened, all of that is the most important thing. And I wouldn't necessarily worry about gross debris. When you're talking about trauma from hit by car, you can see a lot of little bits and bobs in those wounds. If they're big and you can get them, great. If not, I wouldn't waste a lot of time, because we're going to clean everything really good when we get it. When we want to talk about wounds and fractures as well, sometimes we get lucky and these even come in combination, where you get a wound and a fracture. Those are the good ones. So we have a grade 1. And we're going to go through our fracture classification here. We have grade 1, which would just be a small laceration from bone penetration just through the outside of the skin. Grade 2, soft tissue trauma fracture is caused by external trauma. And then grade 3, you have extensive soft tissue injury with extensive bony involvement. And just think like those shearing wounds that you would get. I've seen some pretty gnarly wounds come from lawnmowers. So those lawnmowers, ATVs, yeah, not good. They don't mix well with animals. So when we're talking about dealing with any type of orthopedic injury, specifically open wounds and fractures, cover that bone. Again, if you don't have sterile lube, that's fine. Any kind of lubrication or any kind of non-adherent dressing is going to be fine. So you can't really do it wrong in the short term. And bandage material. Don't push the bone back in. Same rules would apply. I'm sure a lot of this is review or similar to how the human side would do. Wear gloves when inspecting the wounds. I'm sure you all do that anyway. If direct pressure to bleeding does not improve the blood, then we're going to have to go in there and figure it out. But a tourniquet can be used in the interim. Bite wounds are normally from their canines and lower incisors. So if you see a bite mark on the top, make sure that you try to find that corresponding bottom We like to see what the extent of the wound is, especially on those smaller creatures. You can really have a full, almost like a full thickness chest wound where it's a one tooth on one side and one tooth on the other, and you kind of just get a nice little rip tear in there. So before we, I'm almost actually wrapping up fairly quickly. So we're going to go now into some specific things that we look for from an emergency perspective during the summer. Any question on any other trauma things? We really kind of went through that. That was a nice review and a little bit of added stuff from last time, but any questions or thoughts or anything like that? Okay. Well, we'll get into summertime because.
And what about just super fast? I don't remember reviewing tourniquet placement. It seems like it may be obvious, maybe as high up as possible, I would assume.
Yeah, so when I think of, if I'm doing a tourniquet for my forelimb, I'm going to go up behind what looks like their elbow joint. So you're going to kind of hitch it up behind that joint on their first limb. Is my typically anytime I have a wound there, I'm going to go right there first. And then from your hind limb, wherever just above the wound. Straighten and splint angulated extremity fractures. Honestly, I wouldn't place any splint en route. I would do, we call it like a modified Robert Jones. We put like Robert Jones bandages on everything, but I would just do like a really big, well padded bandage just to keep some stability in that area. But we're going to need to take all that off. We're going to rip it all off when you get there anyway.
What's a Robert Jones bandage?
It's really a hind limb bandage. It's a huge bandage that you'd use as layer upon layer of cast padding, and then I used to have a doctor that said, when you think you're done, do one more layer. And so you just build out these really big cushiony layers of cast padding. So you can kind of put them on any long bone. Yeah, kind of like a pillow. Are there any protocols surrounding animal CPR, compressions only while en route? Yeah, so I can do a very quick rundown. And we had, I believe when I was waiting to get led into this class, there is a YouTube channel which may have the previous recordings, but my counterparts Nikki and Steph did a beautiful CPR presentation, so I would urge you to watch that because I won't do it justice. But we use a system called Recover, which is based off of the human technique from what I understand of it, and we start compressions immediately, and you do 2 compressions for 2-minute cycles. There's different options for single rescuer, in which case you would do a full 2-minute cycle of compressions and then do, I want to say 2 to 4 breaths. Do not quote me on that, but it is a number of breaths, and then you do another full 2-minute cycle. So you go 2-minute cycles. And then if you have double rescuer, then you can have someone breathing in between the compressions.
I think they said 2 breaths.
I think so too.
Yeah, I also put a link for the past Academy videos. And
perfect.
They did a great job.
Oh yeah, they're Nikki's. I get my CPR information from Nikki, so she's the resident expert here. But yeah, when all else fails, do compressions in rounds of 2 minutes, and that you can't really go wrong. That's kind of like the best of the best.
Same as an adult.
Yeah. How do we ventilate dogs versus cats? Specific to CPR, or I would say when you're talking about ventilation, you can intubate them. I wouldn't say that is something that would be for the scope of this lecture, but for CPR purposes, you're doing mouth to snout, and there's not really a better option. I do think if you have those masks that can cover their mouth and snout, my worry is you're just not going to build up enough pressure from that to be able to inflate their lungs enough to get that oxygen moving. How do we ventilate? Do any carry special equipment for animals? I'm not sure. As long as you have small oxygen tanks or capacity to deliver oxygen, and you have a mask, you can deliver it to an animal. It does not need to be animal specific. And I typically will just cover either their nose, or I will rest the mask right in front of their mouth. Oxygen is fairly inefficient flow by for animals, although it's better than absolutely nothing. But in that scenario, even if you're just holding a hose in front of their nose, we've seen some success with that too. All right, I think we got them all. If I didn't get your question, type it again. And I will go into our discussion on heat stroke, because I think heat stroke is fascinating and fun, but that's my sick ER brain. So heat stroke is something that we added in because it's summertime. It's the perfect time to talk about it. And heat stroke is just something that is so preventable. So we really just try to spread that education wherever possible. So what does it look like when cats and dogs suffer from heat stroke? And cats and dogs can suffer from heat stroke. I've been hiking in Arizona with a cat, not with myself, but I saw a cat on the hiking trail with its owner. So what does that look like? What are some of those clinical signs that you're going to see? You're going to see panting, very noisy, lots of respiratory noise, restless or agitated behavior, pacing, seeking shade or water. They'll plop down. They're not going to want to go. They're not going to want to move. Drooling, red gums or tongue color, and a temperature above 103 degrees. Brachycephalic breeds, so those smush-faced breeds, are at a higher risk of experiencing heat stroke just from the sheer proportions of their anatomy. There's just not enough of it to go around. And dogs that already have pre-existing conditions of collapsing trachea, heart disease, and laryngeal paralysis are all animals that we get concerned and have a very high risk for heat stroke.
And then collapsing trachea is just like a stridor, right? It's an inspiratory stridor and obstruction, right? Where there's not effective gas exchange.
Correct. Correct. That is a purely mechanical obstruction for the collapsing trachea. That is a mechanical anatomical issue.
They're tugging. The
it
dogs
just goes like this.
The dogs are like tugging so hard.
Yeah. You can, it's a sound. It's like that goose honking. You can hear it from a mile away.
Yeah.
So when we're talking heat stroke, what are some of the actions that we need to take? Get them inside, get them access to water if they are awake, place a fan on them. Our preferred method, and I can never remember if it's conduction or convection, but a fan generates the best cooling for animals. And place cool to room temperature water saturated towels on them, and between the towels and the fan you get a nice little workaround. What are normal cat and dog temperatures? So normal, I lump them together. Normal is anywhere from 99.1 to 103. Normal can be anywhere in that range. Typically, your healthy young animals are going to be 101 to 102.5. But you can go in any other side of that. When we get upwards of 103, at 105, we start looking at brain damage and brain injury, and anything over 106, I'm thinking death is imminent. But I've seen it as high as 109, 110. Those are scary. So those are not normal. So if nothing helps, then we're going to take it you need to get it to the ER. Most of these animals that you encounter that you're concerned about heat stroke, it's probably going to be better just to get them to the ER anyway, just because just the stress of getting them home is probably going to be a little too much, and they're already not going to be able to regulate their temperature, and you're not going to get them to any kind of cooling environment fast enough. It makes the most sense just to bring it to us. So vitals, we are going to see some abnormals here. We're going to see an increased respiratory rate and effort. They're actively cooling themselves. Animals don't sweat. They only have the ability to cool themselves with panting. So again, you're going to see an increased respiratory rate and effort. Hyperthermic, they're going to be over 103. We actually stop active cooling when the animals get to back down to 103. So we active cool until they reach 103, and then we just leave them to their devices and let them come down really nicely on their own. Critical is 105 and above.
How do you actively cool?
How do we actively cool? By setting up the room temperature water towels on the animal with the fans blowing on them. So you have a kind of a mix.
Cool IV fluid?
We don't. We used to do alcohol on the paw pads, ice, the IV fluids. We used to put ice on them, and we found that that caused vasoconstriction in those areas that prolonged our ability or prevented our ability to cool properly. And the cold IV fluids was actually causing some shock and stress to the patient. So we really changed about, maybe 5-ish years ago. And there was a big movement throughout most of veterinary medicine to really stop a lot of that aggressive cooling with ice. And we just do room or warm, like lukewarm water now, no ice, no alcohol. So we have organ failure that can occur at 107 degrees and above. You're looking at increased heart rate, red mucous membranes, and a very, very fast capillary refill time, usually under a second. Again, they're panting to dissipate their body heat. They're unable to sweat. So when we shave our animals in the summer, it really is just for us. But they can move and evaporate to cool themselves by panting and from their paw pads, which was the original thought behind putting alcohol on the paw pads, because you had that evaporation technique, but it was just a little too much, cooled them too quickly. So we can sometimes, when these animals go unchecked and we don't get involved, they can become hypoglycemic. They can have cerebral edema, secondary neurologic signs. They can have seizures. I will say that all of these things happen within a matter of seconds. So most of the time we're seeing them and they begin actively seizing, at which case we do administer anticonvulsant medication just as needed to stop the seizure, but we do continue active cooling the whole time. Mentation may be alert, maybe agitated pacing. I will be honest, I've never seen a heat stroke dog come in pacing. They come in lateral, barely trying to breathe. The presence of petechia, or those pinpoint bruises that we all know and love, is common, can be seen on ears, gums, and abdomen. This is a textbook sign of BIC. Hopefully you don't see it that often. We see it a whole bunch, especially in heat stroke. A lot of times, if they're really bad, they come in with it already. And that's a very poor prognostic indicator for these friends. Again, our brachycephalic breeds or our smush-faced breeds are at a much higher risk for heat stroke. They just don't have the ability to even bring the air in at the rate that they need it to, and they don't have the ability over that nice long nasal passage to warm the air or cool the air or do anything that is needed. Collapsing trachea, like we said, is again that kind of, and laryngeal paralysis are both kind of anatomical defects that they can have that predispose them to this heat stroke. Again, if they're not really able to effectively move air in and out, which they can't in those scenarios, then they're really at a much higher risk. And the animals with heart disease, they're just prone to everything. So that's the end of our content for this evening. Thank you, everyone. This was very enjoyable for me, and I really can't take credit for the content. I just presented it. The Nikki and Steph made this entire presentation themselves, and those were Nikki's animals in the it was bring your own animal to work day, I guess. But if you have any questions, I am happy to address anything. And I did want to make sure I put up all our YouTube stuff. The girls run all of this, and they do just a fantastic job.
Beth, that's great. Thank you so much.
Of course. And thank you for all you do, each one of you. You know, we love and appreciate you at the Pet ER. And oh, I have one thing left I was supposed to say. Last time we offered some tours to anyone that wanted to swing by Pet ER and kind of see how things were. I will have Adrian include Nikki's contact information. Anyone that wants to swing by, she loves giving tours, and she gives a very good tour.
Thank you so much. That is so generous. Thank you.
You are welcome. Thank you all.
Have a great night, Beth. We'll be in touch.
Okay, that sounds wonderful. Thanks again.
Thank you.